about 4 to 6 lecture يعني depend on the time يعني يعتمد على الوقت. بالنسبة للفصل الثاني هو محاضرات الجيرياتريكس. Aging, the most inevitable stage of human life. Geriatrics, definition of geriatrics, the care of aged people. It is a subspecialty of internal medicine. Prevention and treatment of age-related disabilities and performed by geriatricians. يعني الفيزيشن اللي السبيشاليتي مالته أو الفيلد مالته for elderly people يسمونه geriatricians. Geriatric age group is not defined precisely, but the WHO defined the age in those more than 60 years in developing countries يعتبرون old أو geriatric age, or more than 65 years developed countries known as شنو geriatric age. تعرفون شنو developing و developed countries؟ يعني developing already يعني احنا هسه يعتبرونه developing countries. الشرق الأوسط يعتبرونه developing countries, while the others يعني Europe and the USA يعتبر developed countries. يعتمد على من؟ على ال development of culture and the science and other parameters. هذا البينتر أو الرسام اللي هو فرانس باكون عنده مقولة يقول I will never be an old man. To me, old age is always 15 years old than I am. Demography. Demography هو علم السكان يسمونه علم السكان. فديموغرافي at years of 100 the more than in US more than 65 the people more than 65 about 4%, while at this day the present day the prevalence or percentage of people more than 65 reached to 13%, while in 2026 it will become 20%. The rate of population aging is much faster in developing country. This diagram represents the difference between the numbers or frequency of geriatric age group in the world in comparison with developing and developed countries. As we know, this the يعني الكلر الوورد اللي هو color green أو green, yes. This green in 2010 reached to about 500 million. This is, I mean, the geriatric age group. While this, the pink or red, light red, mean the developing countries also at about 300 million. And the blue, the developed countries also reached to 200 million. This is in 2010. While we expect in 2025 all over the world the age group more than 65 reached to more than 800 million, and in the 2050 may reach to more than 1,500 million, and also the developing and developed also the number difference. Giant of geriatrics. What's mean of giant of geriatrics? يعني the more يعني عمالقة ال problems اللي تصير بالgeriatrics. This mentioned by إسحاق in 1970. The more يعني I mean the main problems in the geriatrics. It is summarized in these 5 terms. Immobility, one of the big problem of geriatrics. Instability, also it is a big problem. Intellectual impairment, one of the most common problems in geriatrics. Incontinence, also it is a big problem. Iatrogenesis, iatrogenesis تعني الأشياء اللي هي يعني drugs مثل المريض ماخذ او اشياء اللي هي ما لها علاقه بالفسيولوجي، اشياء مصطنعه. Presenting problems in geriatric medicine. Characteristic of presenting problem in old age divide by more than 2 level. Late presentation. Many people of all age accept ill health as a consequence of aging and may tolerate symptoms for lengthy period before seeking medical advice. I mean, the patient can withstand the disease, but cannot withstand the disease for more than not longer period. So the ill health, the consequence of the presentation of this ill health different from each age group from others. A typical presentation, as we know, any patient with infection, if get infection, complain from symptom of infection. First of all, fever. I mean in any age group, but in geriatrics, the presentation was different. Infection may present with delirium and without clinical pointers to the organ system affected. Any patient with elderly more than 65, if present with infection, may present with delirium. So it is a typical presentation. Stroke may present with fall rather than symptom of focal weakness. Myocardial infarction may present as weakness and fatigue without the chest pain and dyspnea. Cognitive impairment may limit the patient's ability to give history of classical symptom. Any patient presented with any acute illness must have orientation if present with abdominal pain, other, so you can take history from the patient himself. In geriatrics, the story different completely. Acute illness and change in function. A typical presentation in a frail elderly patient include failure to cope. يعني شنو failure to cope؟ يعني فشل أو عدم القدرة على التأقلم. Found on a floor. We know what's the found on a floor. Confusion and off feet. يعني ممكن تلقى ملقى على الأرض أو confusion and off feet يعني بدون عفوا يعني shoes or slippers. Multiple pathology in geriatric age group. Presentation in older patients have more diverse differential diagnosis because multiple pathology is so common. There are frequently a number of causes for any single problem, and adverse effects from medication often contribute. What is the approach for those patients? I mean the geriatrics age group. Approach to presenting problem in old age group. The approach to most presenting problem in old age can be summarized as follows. First, obtain collateral history. Find out the patient's usual status, mobility, cognitive status, from relative or carries. يعني الhistory we taken from the relative, because the patient, as I mentioned, there is a lot. I mentioned this here. Failure to cope found on the floor. How do we know the history? We take the history from the relative or carriers. Carriers يعني اللي هو يعينه. Check all medication. Have there been any recent changes? Search for and treat any acute illness. Identify and reverse predisposing risk factors. These depend on the presenting problem. History. Slow down the pace. Slow down the pace. يعني شنو؟ البيشنت from the history we know السرعة مالته راح تقل بالنسبة للmovement، بالنسبة للtalk، بالنسبة للanything. Ensure the patient can hear. Establish the speed of onset of acute illness. If the presentation is vague, carry out systematic inquiring. Okay? Obtain full details of all drugs, especially any recent prescription changes. past medical history even from many years previously, usual function, can the patient walk normally, has the patient noted memory problems, can the patient perform all household tasks. This is important. Obtain collateral history, confirm information with a relative or carrier, and general practitioners, particularly if the patient is confused or communication is limited by deafness or speech distribution. This is very important, how to approach the patient with presenting a problem and he is elderly or geriatric age group. Reach to the examination. ثرو بالحقيقة طبعا هاي الليكتشرز هي introduction into geriatrics. We have another lectures in details. Thorough to identify all comorbidities. Tailored to the patient's stamina and ability to cooperate. يعني شنو tailored to the patient's stamina and ability to cooperate؟ يعني معرفة انه البيشنت كان tailored يعني يتناسب على يعني قدرة المريض المناسبة على احتمال take the examination. يعني انت شنو؟ يعني when we do examination for the patient we know that the patient can able to withstand the examination. يعني يقدر يتحمل انه انت تسوي له examination. طبعا في the examination include functional status, cognitive function, gait and balance, nutrition, hearing and vision. Social assessment, it is the functional status. Home circumstances, living alone with another or in a care home. Activities of daily living, هاي مهمة. activities of daily living يتقسموها domestic و personal. activities of daily living domestic اللي هو shopping, cooking, housework يعني أعمال المنزلية. personal advanced activities of daily activities اللي هو BADL اللي هو bathing, dressing, walking. informal help, relatives, friends, neighbors. Formal social services اللي home help, meals on wheel. Screening investigation of acute illness. What's the investigation for any patient with acute illness? Full blood count, urea and electrolyte, liver function test, calcium and glucose, chest x-ray, ECG, C-reactive protein, useful marker for occult infection or inflammatory disease. A blood culture is if pyrexia. Frailty loss of an individual's ability to withstand minor stress. There is a scale يسمونها frailty scale. هذا on this scale we know the ability of the geriatric age group to withstand minor stress. The scale يشمل unintentional weight loss, muscle weakness, exhaustion, low physical activity, slowed walking speed. This is 5 scales اللي هو unintentional weight loss, muscle weakness, exhaustion, low physical activity, slowed walking speed. هاي الخمسة. A healthy person السكور 0. Very frail person اللي هو have 5 score. واضح؟ فهذا الفرايلتي سكور اللي هو to know whether the patient can withstand minor stress or not. One of the big problem of geriatric age group, it is the fall. The fall around 30% of those over 65 years of age fall each year. This figure rising to more than 40 in those age over 80. Although only 10 to 15% of fall result in serious injury, they are the cause of more than 90% of hip fracture in this age group, compounded by rising prevalence of osteoporosis. High falls هو a big problem in geriatric age group. What is the risk factor for falls? First, muscle weakness, history of falls, previously, gait and balance abnormality, use of walking aid يعني يعتكز على عكازة, visual impairment, arthritis, impaired activities of daily living, depression, cognitive impairment, age more than 80, and psychotropic medication. Any patient with dementia or other diseases can take medication, may affect on the cognition and it cause fall. What is the abnormal gait and the probable cause? Gait abnormality in geriatrics, antalgic gait, well, most probable cause it is the arthropathy, waddling gait, mostly due to proximal myopathy, stamping اللي هو sensory neuropathy, foot drop اللي هو peripheral neuropathy or radiculopathy, ataxic gait, sensory neuropathy or cerebellar disease, shuffling or festination, mostly this is common manifestation of Parkinson, and march بتت باص، يعني شلون ذول الحرس اللي هو مال الجنازه يمشون مثل مشي الجنازه العسكريه اللي هو due to small vessel cerebrovascular disease او hemiplegic اللي هو stroke mostly cerebral hemisphere lesion and apraxic gait معروفه بالbilateral hemisphere lesion. Other problem other than the falls, what is the dizziness? Dizziness is a very common, affecting at least 30% of those age over than 65 in community surveys. Dizziness can be disabling in its own right and is also a risk factor for falls. Acute dizziness is relatively straightforward and common cause include hypotension due to arrhythmia or myocardial infarction or due to gastrointestinal bleeding or pulmonary embolism. All these cause hypotension and cause dizziness. Onset of posterior fossa stroke also present with dizziness, or lastly vestibular neuritis. Third problem, which is the delirium. Delirium is a syndrome of transient, reversible cognitive dysfunction. It is very common, affecting 30% of older hospital inpatient either in admission or during their hospital day. What is the risk factor for delirium? Predisposing factor, it is the old age, as I mentioned, dementia, frailty. This is the predisposing factor. Precipitating factors, intercurrent illness, surgery, change in of environmental or ward, sensory deprivation like darkness or overload, example noise, or medication like opioid or psychotropics. And the predisposing factors and the precipitating factors, there is many impairment like sensory impairment, polypharmacy, renal impairment. The dehydration also as a predisposing factor, pain, constipation, urinary catheterization, acute urinary retention, hypoxia, fever, alcohol withdrawal. Common causes and investigation for all these problems, and lastly mainly the dizziness and delirium. Infection like pneumonia, UTI, skin infection, and if the patient have infection, do full blood count, seroactive protein, and other investigations. Metabolic disturbances like acute renal insult or hyponatremia, hypercalcemia, hypoglycemia, hepatic encephalopathy, thiamine deficiency or B12 deficiency or hypothyroidism. This metabolic disturbance cause all these problems, cause delirium, dizziness, falls, and the investigation were urea, electrolytes, plasma, calcium, and others. Toxic insult like any drugs like anticoagulant, digoxin, opioid, psychotropics, and if the digoxin level is prescribed, take history from the relative or carrier. Acute neurological condition, stroke, hematoma, encephalitis, meningitis, and CT brain must be done for those. So this is the summary for common causes and investigation, and everybody must know what happened. The other problem, which is the urinary incontinence, it is occur in all age group, but become more prevalent in older age group, affecting 15% of women and 10% of men over than 65 years old. The approach for patient with incontinence, address your contributory factor like UTI, severe constipation, drugs like diuretics, hyperglycemia, hypercalcemia, restricted mobility, acute confusion. طبعا هاي الكوزز ممكن يصير بال any age group, but in elderly cause urine incontinence. If still incontinence, establish the pattern of urinary loss اللي هو diary is helpful. Measure residual urine volume by ultrasound. Assess for vaginal prolapse and atrophic vaginitis in women, or assess for prostate or rectal examination in men. In urge bladder retaining anti-muscarinic drugs, example sulfoniacin or tollerodine. In citrus pelvic floor, muscle training, surgical intervention if unsuccessful. Overflow if the volume more than 100, surgical relief of obstruction, example prostatectomy or intermittent catheterization. This is the approach for incontinence. Drugs, a lot of geriatric age group can be on drugs. Drug-related problem in geriatrics: decline in psychological reserve in organ, dose adjustment needed, a drug interaction and adverse reaction, polypharmacy. Adverse drug reaction, most common drugs for adverse drug reaction in old age, non-steroidal, and the adverse effect, as we know, GIT and peptic ulcer. Diuretics cause renal impairment and electrolyte disturbances and gout. Warfarin cause bleeding. AC may cause renal problem or electrolyte disturbances, hypotension, postural hypotension. Beta blocker, bradycardia, heart block, hypotension, postural hypotension. Opioid, constipation, vomiting, delirium, urinary retention. Antidepressants cause delirium, hypotension. I mean, all these drugs may get big problem in geriatrics, and each drugs have a side effect. You can read more details on it. What is the factor leading to polypharmacy? شنو الفاكتور اللي تخلي البيشنت in elderly take more than one drug? The patient have multiple pathology. ممكن عنده ischemic heart disease, ممكن عنده renal failure, ممكن عنده stroke. A lot of medication for each disease. So this may cause polypharmacy in old age. Poor patient education. Patient cannot have good education. So take a lot of drugs وتعرفوها النسوان العجائز. كل شيء تشوفه تاخذ حباية فيقول لك وجع راس. Lack of routine review of all medications. Patient expectation of prescribing. يعني هو عنده فد قناعة انه هذا هو prescribed by physician فانه هو insist to take the drug. Overuse of drugs intervention by doctors. يعني a lot of physician may interfere with the drug medication change the drug daily every times. Attendance at multiple specialist clinic. يعني دائما هو يراجع عدة specialist. Poor communication between specialists. هذا هو المشكلة. يعني ممكن هو يراجع طبيب جراح على مود البروستات، ممكن يراجع طبيب عصبية على مود الديمنشيا. اكو شيء يسمونه comprehensive geriatric assessment. Comprehensive geriatric assessment defined as multidisciplinary diagnostic and treatment process. Medical, psychological and functional limitations. Coordinated plan to maximize health. It differs from a standard medical evaluation by focus on elderly individual, emphasize on functional status and quality of life, multidisciplinary approach. Patient selection, your criteria for comprehensive geriatric assessment: high-risk elderly patient, frail or chronically ill, medical comorbidities, heart failure or cancer, a specific geriatric condition مثل dementia, falls, functional disability, psychosocial disorders such as depression or isolation. Major component of comprehensive geriatric assessment: functional capacity, fall risk, cognition, mood, polypharmacy, social support, financial consent. هذا البروجرام مهم. Domain of comprehensive geriatric assessment طبعا functional حكيناها, ability, disease, severity and comorbidities, support network and need, and mental health and cognition. Additional component: nutrition, weight changes, urinary incontinence, sexual function, vision, hearing, definition, dentation I mean, يعني dental caries, living situation and spirituality. Comprehensive geriatric assessment, I mentioned this and you can review this photo. The subspecialty for elder age group in medicine هو cardiogeriatrics or geriatric psychiatry, geriatric rehabilitation أو geriatric rheumatology and etc. هذا ندرس. In surgery, orthogeriatrics, geriatric cardiothoracic surgeon or geriatric urology. Other geriatric intensive care unit, geriatric nursing or geriatric nutrition and etc. The rehabilitation aims to improve the ability of people of all age to perform day-to-day activities and to restore their physical, mental, and social capability as far as possible. The rehabilitation process: assessment, goal setting, interventions, and lastly, reassessment. International classification of functioning and disability. There is a lot of factors like health condition, underlying disease like stroke, impairment, symptom or sign of condition as hemiparesis or visual loss, activity limitation, and the resultant loss of function, participation restriction, resultant loss of social function. هاي كلها يسمونها international classification of functioning and disability. هذا for elderly. طبعا intervention for any disease هو medical surgical treatment and others. The team for geriatrics هو multidisciplinary team working, including the psychotherapy, occupational therapies, and the dietitians, speech language therapies, social worker, nurse, and each specialty or team have the activity assessment. مثل occupational therapies هو advanced daily activity, dressing or cooking or others. النيرس motivation and initiation of activities. طبعا الالدرلي هذا physiological changes cannot prevent it, but a lot of research about for causes and for the management of the geriatric problem. Like hospital elder life program, هذا البروجرام اللي هو يسمونه HELP hospital elder life program, designed to prevent delirium and functional decline in hospitalized patient setting. 40% incidence of delirium can be prevented. هي طبعا كلها research، ماكو في شيء document to prevent delirium و prevent fall و prevent geriatric physiology. Replicated in over 63 hospitals across the world. Acute geriatric based ward اللي هو هذا geriatric based ward، هذا لا تشوف الصور، هاي الورد لازم versus general ward، هاي الجيرياتريك وهاي general ward. For older acute medical patient, randomized comparison of outcome and use of resources. The acute geriatric based ward shortened the length of hospital stay and may have cut down need for long-term institutional living. طبعا المحاضرة انتهت إن شاء الله، وأي سؤال أنا حاضر. البيولوجي and genetic هذا advanced technique for prevention of geriatric problems، هو biology and genetics of aging. مقولة: are we able to slow or even stop the body clock at least for a little while? This is the question اللي هو كل العالم دايخ بيه، إنه how to prevent the aging process. Thank you.